Hi everyone, my name is Nikki Danner, and I would like to present our project, The Use of Continuous Albuterol in a Pathway for Treatment of Pediatric Acute Asthma Exacerbation. Respiratory therapist-driven protocols help to standardize and improve quality of care. We use an RT-driven, score-based asthma pathway for children ages 2 and older admitted to the hospital for acute asthma. The pathway uses a modified pediatric asthma score and provides guidance for treatment, including continuous albuterol. The asthma score is reassessed every 2 hours while receiving continuous albuterol. This is the scoring system we use. We evaluate respiratory rate, pulse oximetry, breath sounds, presence of retractions, and dyspnea. A higher score indicates more severe symptoms. If a child scores in the moderate or severe range, they are a candidate for continuous albuterol. In the ED, a score of 12 or more is an indication to start continuous albuterol, and it is an option when the score is 8 to 11. The patient is reassessed and rescored after 1 hour of treatment. Continuous can be stopped when the score is 11 or less. For inpatients who require continuous, it can be discontinued after 4 hours of treatment if the score is 11 or less. In our practice, we use a large volume nebulizer with a face mask to administer continuous albuterol, unless respiratory support such as high-flow nasal cannula or non-invasive ventilation is required, and then a vibrating mesh nebulizer is used. We evaluated the use of continuous albuterol with the asthma pathway as part of the quality improvement study. Inclusion criteria were children 2 years and older admitted to the PICU or step-down unit for acute asthma between November 2017 and December 2019 and received continuous albuterol as part of the asthma pathway. Only the first admission was included. Chart data was collected retrospectively and included demographics, asthma classification, continuous albuterol dose and duration, type of nebulizer to deliver continuous, the pediatric asthma score before continuous was started, while it was being given and after discontinuation, respiratory support required while receiving continuous, if they were prescribed an inhaled steroid prior to admission, length of stay, and readmissions or ED visits within 30 days of discharge. Descriptive statistics were used to summarize results. 412 children were included. The median age was 6 years. Most were male, Black, and non-Hispanic. The majority were admitted from the ED to the step-down unit, and most were classified as having moderate persistent asthma at the time of admission. The median starting dose for continuous albuterol was 15 milligrams per hour, and median time on continuous was 560 minutes, or a little over 9 hours. The large volume nebulizer was most commonly used. The median asthma score before continuous was started and while receiving it was 11, and after it was stopped, the median score was 6. 16% of subjects had missing scores before starting continuous, and 2% during and after. 29% required respiratory support, with most of those being high-flow nasal cannula. 3% required restart of continuous after it was initially discontinued. Only 2% required transfer to PICU for escalation of care. There are no pneumothoraces or deaths reported. Almost half of all children were prescribed an inhaled steroid prior to the admission. The median length of stay was 1.4 days, and there were very few ED visits or readmissions within 30 days of discharge. Studies have shown that asthma management protocols can improve patient outcomes and increase adherence to treatment guidelines. The pediatric asthma score is a validated tool used to determine treatment for acute asthma, and continuous albuterol is safe and well tolerated. There were several limitations to our study. This was a retrospective chart review. There were some instances of missing asthma scores, so it isn't known if the score was within the parameters for indication for continuous. And we only reviewed the chart to see if inhaled steroids were prescribed prior to the admission. We did not evaluate if they were adherent to therapy. We found the asthma pathway to be safe when using it to initiate and discontinue continuous albuterol. There were few escalations of care, and ED visits and readmissions within 30 days of discharge did not occur often. We need to further explore the missing asthma scores and increase our efforts to improve documentation.